Hello learners! How are you today? I hope you are all fine, safe, and healthy. Join me as we discuss the different health-related laws. I am Teacher Feby Jesua I. Andoyo from SDO Calamba City. Our module came from DepEd LMS Quarter 2, Module 1. After going through this module, you are expected to discuss the existing health-related laws. But before we proceed to our discussion, let us first have this activity. Read and analyze the question inside the box. What are the health issues and concerns that you experience as a teenager? Write your answers on your notebook. While you are answering, let me read to you the different health issues according to World Health Organization. First, injuries. Second, violence. It can be bullying, domestic or family violence, or sexual violence. 3. Mental health disorders. 4. Alcohol and drug use. 5. Tobacco use. 6. HIV or AIDS. 7. Other infectious disease. 8. Early pregnancy and childbirth. 9. Nutrition and micronutrition deficiencies. For example, iron deficiency. And number 10, undernutrition and obesity. For our next activity, read the conversation and answer the following questions. Write your answer in your activity notebook. Let me read to you the conversation between a client and a customer service of a boutique. Client: Good day. I have received the bag I ordered in your store. I was so excited to open the package to check on the item, but I was disappointed to see a different color of the bag I ordered. I ordered red, but you sent me brown. Moreover, when I opened it, I found damage on the zipper and on its inside pocket. I am sending this message to complain and to ask replacement of the item. I demand for immediate action about this matter. Thank you. Customer service replied, Good day, sir. Before we process your complaint, may I have your name and address? The client said, Timothy Roses, San Isidro, Candon City, Ilocos Sur. Customer service replied, On behalf of our online shop, I say sorry for any misfortune our item has caused you. Please secure your receipt and the item. Please send it to Candon Padala Center and we will process the replacement. Please wait for 2 to 3 weeks. June Cabral, Customer Service. Here are the processing questions. 1. What is the sender's problem? 2. Have you experienced the same situation? What did you do? You may answer on your notebook. Like the client earlier, you may have experienced being disappointed about the product or the service that you have availed. That is why our government created different health laws for the consumer's protection. And what are those? First, we have the Consumer Act of the Philippines, or RA 7394. It is a national policy which aims to protect the interests of the consumers and buyers of products and services. promote consumers' general welfare, and to set and maintain standards of conduct for both the business and industrial sectors. That is why proper labeling and fair packaging shall be required for all the products being sold. Number 2. Traditional and Alternative Medicine Act of 1997, or RA 8423. It is an act creating the Philippine Institution of Traditional and Alternative Healthcare, or the PTAC, to accelerate the development of traditional and alternative healthcare in the Philippines, providing for a Traditional and Alternative Healthcare Development Fund and for other purposes. Number 3. Responsible Parenthood and Reproductive Health Act of 2012, or RA 10354. The Responsible Parenthood and Reproductive Health Act of 2012, also known as Reproductive Health Law, or RH Law, is a law in the Philippines that guarantees universal access to methods such as contraception, fertility control, sexual education, and maternal care. What is reproductive health? It refers to the state of complete physical, mental, and social well-being, and not merely the absence of disease, relating to the reproductive system and to its functions and processes. This implies that people can have a responsible, safe, consensual, and satisfying sex life, that they have the capability to reproduce and the freedom to decide if, when, and how often to do so. This further implies that women and men attain equal relationship in matters related to sexual relations and reproduction. The Responsible Parenthood and Reproductive Health builds its foundation on 4 pillars. Pillar 1. Informed choice. This is to ensure the health of the mother and the child, an effective and quality reproductive healthcare services, which are ethically and medically safe, legal, accessible, and affordable, shall be given primacy to them. The government shall also promote and provide unbiased information and access to these services. This pillar also covers the provision for the integration of reproductive health and sexuality education in schools and other educational settings. Pillar 2. Respect for life. The Act recognizes that abortion is illegal and punishable by law. However, mothers who will be identified to have aborted an unborn child will be served with post-abortive treatment and counseling in a humane, non-judgmental, and compassionate manner. Pillar 3. Birth control. Reproductive health care information and supplies shall be made available, most especially to poor beneficiaries. However, the Act also provides that the government must respect the citizens' individual preferences and choices of family planning method. Pillar 4. Responsible parenthood. Couples determine their ideal family size. In addition, the government shall equip each parent with needed information in all aspects of family life, reproductive health, and this pillar. What is family planning? This is a means to improve the quality of life of every Filipino. It is a program which enables couples and individuals to decide freely and responsibly the number and spacing of their children. Couples decide when to have the next baby and use responsible means to achieve their desired number of children. The program also provides access to a full range of safe, affordable, non-abortifacient, modern, and natural methods of pregnancy planning. What is responsible parenthood? Parenthood is about raising children and supporting their needs financially, morally, teaching them good values, and giving them love and care. It is one of the most important duties in our society. Parenthood is a great responsibility or task. It is not a role which can be successfully played based on chance. It is a status which a responsible couple can arrive at after deciding to have a family. Couples should be aware that parenthood entails great responsibilities. They should consider the 3 R's before becoming parents: the reason for wanting a child, the resources needed to raise a child, and the responsibilities as parents. Here are some of the responsibilities of parents. 1. Provide physical care. 2. Inculcate discipline. 3. Develop social competence. 4. Encourage learning. 5. Give opportunities for education and self-learning. 6. Inculcate values. 7. Provide economic security. 8. Teach self-discipline and self-control. 9. Give love and affection. And 10. Teach them with a positive attitude. Number 4 in health law is the Philippine AIDS Prevention and Control Act of 1998, or RA 8504. RA 8504 is an act promulgating policies and prescribing measures for the prevention and control of HIV or AIDS in the Philippines, instituting a nationwide HIV or AIDS information and education program, establishing a comprehensive HIV or AIDS monitoring system, strengthening the Philippine National AIDS Council, and for other purposes. So what is HIV, or the Human Immunodeficiency Virus? It is a viral infection that attacks and slowly destroys the immune system of the infected person that leads to immune deficiency. It is progressive and can lead to lack of body defense to all kinds of infection, including those that do not normally infect man, and can also lead to cancer susceptibility. What is AIDS, or acquired immune deficiency syndrome? It is a condition characterized by a combination of signs and symptoms caused by HIV contracted from another person. AIDS attacks and weakens the body's immune system, making the person who contracted the disease susceptible to other life-threatening infections. What are the other provisions of RA 8504? The Department of Education and other government agencies should work together so that information on AIDS is included in the classroom. The causes, modes of transmission, and ways of preventing HIV or AIDS and other sexually transmitted diseases should be taught in schools at intermediate grades, secondary, and tertiary levels, including non-formal and indigenous learning systems. How do you get or transmit HIV? You can only get HIV by coming into direct contact with certain body fluids from a person with HIV. These fluids are blood, semen, rectal fluids, vaginal fluids, and breast milk. HIV is transmitted by unprotected sex, passing from infected mother to a baby, sharing contaminated injecting equipment, contaminated blood transfusion. HIV is not acquired or transmitted by insect bites, toilet seats, kissing, sharing eating utensils, and touching. The next health-related law is number 5, National Blood Services Act of 1994, or RA 7719. Republic Act number 7719 promotes voluntary blood donation to provide sufficient supply of safe blood and to regulate blood banks. This act aims to inculcate public awareness that blood donation is a humanitarian act. When you donate blood, you help save lives. Number 6, Cybercrime Prevention Act of 2012, or RA 10175. Cyber refers to a computer or a computer network, the electronic medium in which online communication takes place. Consequently, cybercrime is simply any crime committed in cyberspace. To protect the citizens from this concern, the government mandated Republic Act number 10175, or the Cybercrime Prevention Act of 2012, that mandates the prohibition of cybersex, child pornography, unsolicited commercial communications, and computer-related identity theft. The cybercrime offenses are: letter A, offenses against the confidentiality, integrity, and availability of computer data and systems. These are illegal access, illegal interception, data interference, system interference, misuse of device, and cybersquatting. The cybercrime offenses under computer-related offenses are computer-related forgery, computer-related fraud, and computer-related identity theft. The cybercrime offenses under content-related offenses are cybersex, child pornography, also under RA 9775, unsolicited commercial communications, and libel. Number 7 in our health-related law is the National Environmental Awareness and Education Act of 2008, or RA number 9512. This act provides for the promotion of environmental awareness through environmental education, which shall encompass environmental concepts and principles, environmental laws, the state of international and local environment, local environmental best practices, the threats of environmental degradation and its impact on human well-being, the responsibility of the citizenry to the environment, and the value of conservation, protection, and rehabilitation of natural resources and the environment. Number 8. Seatbelts Use Act of 1999 or RA number 8750. This act aims to secure and safeguard its citizenry, particularly the passengers and drivers of private and public motor vehicles, from the ruinous and extremely injurious effects of vehicular accidents. The policy includes the mandatory wearing of seatbelt by the drivers and front seat passengers of private and public motor vehicles. Number 9. Comprehensive Dangerous Drugs Act of 2002, RA number 9165. The Comprehensive Dangerous Drugs Act of 2002, or RA number 9165, safeguards the well-being of its citizenry, particularly the youth, from the harmful effects of dangerous drugs on their physical and mental well-being, and to defend the same against acts or omissions detrimental to their development and preservation. In view of the foregoing, the state needs to enhance further the efficacy of the law against dangerous drugs, it being one of today's most serious social ills. Now, let's wrap what you have learned for today. First, you have learned about the Republic Act No. 7394, or the Consumer Act of the Philippines, which protects the rights of consumers. Next, Republic Act 8423, or the Traditional and Alternative Medicine Act of 1997, or TAMA, provides for the improvement of quality and delivery of healthcare services in the country. We also learned the act that aids and helps the citizens from their reproductive needs, also known as RA 10354, or the Responsible Parenthood and Reproductive Health Act. You have learned the Philippine AIDS Prevention and Control Act of 1998, or RA 8504. This consists of the policies and measures that can help the individuals and allows people to be educated and have information about this issue. Next is RA number 10175, or the Cybercrime Prevention Act of 2012. This mandates the prohibition of cybersex, child pornography, unsolicited commercial communications, and computer-related identity theft. Next, you've learned RA number 7719, or the National Blood Services Act of 1994. This aims to promote and encourage voluntary blood donations by the citizenry. You also learned about the National Environmental Awareness and Education Act of 2008, or the RA number 9512. This act provides for the promotion of environmental awareness through environmental education. Next, RA number 9165, or the Comprehensive Dangerous Drugs Act of 2002, which safeguards the well-being of its citizenry, particularly the youth, from the harmful effects of dangerous drugs on their physical and mental well-being. And lastly, RA number 8750, or the Seatbelts Use Act of 1999, which aims to secure and safeguard drivers and passengers of motor vehicles from injuries and other effects of vehicular accidents. On your module, you have this activity. Let us read the directions. Identify what kind of cybercrime offenses are the following. Choose the letter of the correct answer from the choices below and write your answers in your activity notebook. Good job! Let me reveal the answers for this activity. Number 1 and number 8 belongs to letter C, or content-related offenses. Number 2, number 7, and number 10 belongs to letter D, or computer-related offenses. And numbers 3, 4, 5, 6, and 9 belongs to letter A, or offenses against the confidentiality, integrity, and availability of computer data and systems. Next, in your module, we have this assessment 1. Complete the following paragraphs using the words in the box below. Write your answers in your activity notebook. So let me reveal the answers to this activity. Parenthood is about raising children and supporting their needs financially, morally, teaching them good values, and giving them love and care. It is one of the most important duties in our society. Parenthood is a great responsibility or task. It is not a role which can be successfully played based on chance. It is a status which responsible couple arrive at after deciding to have a family. Couples should be aware that parenthood entails great responsibilities. They should consider the 3 R's before becoming parents: the reason for wanting a child, the resources needed to raise a child, and the responsibilities as parents. For assessment 2, you are going to answer the following questions and write this on your activity notebook. Number 1. What is HIV? What do the letters stand for? What can the virus do to a person's immune system? Number 2. What is AIDS? What do these letters stand for? What's the difference between being tested positive for HIV and having AIDS? Number 3. How do people get HIV? How can people protect themselves against it? So you may answer this on your notebook. For your performance task, here is the direction. Choose any of the roles you would like to do and perform the given task. You may choose from these roles. First, a newspaper reporter. Second, a photographer. And third, a writer. If you choose in becoming a newspaper reporter, your task is to write a news article about any of the discussed health-related laws that interests you. Use one whole sheet of paper. If you choose photographer, take or collect interesting pictures that are related to any of the discussed health-related laws. Paste the pictures in an Oslo paper or a bond paper. Next, if you choose being a writer, write an article about the good effects of the discussed health-related laws in your community. Write your article in a short bond paper. The rubrics is on your module. After doing this activity, you may submit it to your health teacher. For our assessment, directions: choose the letter that corresponds to the correct answer. Are you ready? Get your pen and your paper. Number 1. What act aims to address legal issues concerning online interactions? Is it A. Republic Act 7719? Letter B. Republic Act 10175? Or letter C. Republic Act 10354? If your answer is letter B, you are correct. Number 2. What act aims to protect people against hazards to health and safety, and deceptive and unfair sales acts and practices? Is it A. Republic Act 7394? B. Republic Act 7719? C. Republic Act 8504? If your answer is letter A, you are correct. Number 3. What act promulgates policies and prescribing measures for the prevention and control of HIV or AIDS in the Philippines? Is it A. Republic Act 10354? B. Republic Act 8504? Or letter C. Republic Act 10175? If your answer is letter B, then you are correct. Number 4. What act promotes voluntary blood donation to provide a sufficient supply of safe blood and to regulate blood banks? Is it A. Republic Act 8504? Letter B. Republic Act 7394? Or letter C. Republic Act 7719? If you answered letter C, you are correct. And last question, number 5. What law in the Philippines guarantees universal access to methods on contraception, fertility control, sexual education, and maternal care? Is it A. Republic Act 10354? B. Republic Act 10175? Or letter C. Republic Act 7394? If you answered letter A, then you are correct. Good job, kids! Here is the second part of your assessment. Directions. How do the following policies or acts help the consumers? Explain with an example. Write your answers in your activity notebook. Number 1. RA 7394, or the Consumer Act of the Philippines. Number 2. RA 8423, or the Traditional Alternative Medicine Act of 1997. Number 3. RA 10175, or Cybercrime Prevention Act of 2012. Number 4. RA 7719, or National Blood Services Act of 1994. Number 5. RA 8504, or Philippine AIDS Prevention and Control Act of 1998. Number 6. RA 10354, or Responsible Parenthood and Reproductive Health Act of 2012. Number 7. RA 8750, or Seatbelts Use Act of 1999. Number 8. RA 9512, or National Environmental Awareness and Education Act of 2008. And lastly, number 9. RA number 9165, Comprehensive Dangerous Drugs Act of 2002. And that's a wrap for today. I hope you learned a lot in our lesson. This has been your teacher, Teacher Freddy Joshua Ayanboyo, MAPEH teacher from SDO Calambasi. You can reach me from my Facebook, Messenger, or email account. If you like this video, Don't forget to like, share, and subscribe. Thank you.